Hi everyone, my name is Katie Lane and I'm with Truven Health Analytics, an IBM company. Truven Health is the education, training, and assistance contractor for MACPro. And the purpose of today's webinar is to help you understand the roles and their responsibilities in MACPro's Medicaid, MAGI eligibility and administration, creation, review, and submission process. By the end of this presentation, you will understand the next steps for getting ready to work on MAGI and administration SPAs in MACPro. So currently, your lines are muted to prevent background noise, and there will be an opportunity to ask questions at the end of the presentation. So as we move through the presentation, as Renee mentioned, please feel free to submit your questions through the chat feature as you think of them. We will address these at the end of today's session. And CMS and training personnel are here to assist with any questions that you may have. Also, please note that we are recording this session for future viewing, and the slides presented today are included in the meeting invitation and will be available for download at the end. We have a full agenda for today. We'll start with an introduction to MACPro. Then we will discuss the transition plan for MACPro, Medicaid, MAGI, and eligibility and administration, including details on the transition from the Medicaid Model Data Lab, which you probably know as MMDL, to MACPro. After that, we will review the general process flow for obtaining access to MACPro, followed by a review of available MACPro state user roles and the submission workflow in which they are involved. The webinar will end with how to obtain help and technical assistance, next steps, and an opportunity to ask questions. So we are going to start off with what exactly is MACPro. So if you are an existing user, you probably are already aware of this, but if you're new, we're going to run through this to acquaint you with MACPro. It is a web-based system for the submission, review, and disposition and management of Medicaid and SHIP initiatives, such as Medicaid state plan submissions and quality measurement reporting. For some applications, MACPro is a new online submission tool, and for others, it will be a change from what was a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. In terms of Medicaid, MAGI, eligibility, and administration state plan amendments, MACPro will eventually replace the Medicaid Model Data Lab, which, as I mentioned before, you probably know as MMDL, and the paper-based process of submitting and reviewing MAGI and administration SPAs. There are key features in MACPro that we would like to highlight for you. First, SPA templates and implementation guides have been designed to clearly identify available policy options and include built-in logic to reduce errors. This ensures that upon submission, SPAs are complete and reflect correct application of policy. MACPro features an automated workflow that routes each SPA directly to the appropriate staff member within the state and CMS. Workflow actions are assigned to users as tasks to keep the submission progressing in a timely manner. And finally, MACPro also hosts system functionalities that may be new to you, and we're going to go through these in further detail later on in the presentation. MACPro is being implemented for various reasons. In addition to simplified SPA templates, automated workflow, built-in logic, and clear communication, MACPro offers improvements in transparency via the ability to check submission status, data-driven decision-making for Medicaid and SHIP programs, and consolidation of multiple systems for standardized data definitions across programs. Over time, MACPro will be a single point of entry to many CMS applications, including but not limited to the ones listed on this screen. Now let's discuss the transition to MACPro. Medicaid MAGI Eligibility and Administration will be going live in MACPro on August 28, 2017. This transition will include the following state plan authorities: mandatory and optional MAGI-based eligibility groups. There will be additional eligibility sections including state residency, citizenship and immigration, and presumptive eligibility, as well as single state agency sections. MAGI eligibility and administration SPAs currently being processed in MMDL will be completed in MMDL. And as of August 28, 2017, all new SPA actions should be made in MACPro. Additionally, draft SPAs will no longer be accessible in MMDL as of August 25th. When subsequent SPAs are submitted and approved in MACPro, they become the official record.
This is Stephanie. I just want to jump in to reiterate that point that up through Friday, the 25th of August, you'll be able to complete any drafts that you've already got started in MACPro, and then beginning the following week, anything new will have to be started in in MACPro. So finish up what you've got in MMDL now so that we can transition it over to MACPro.
Thank you, Stephanie. So the data in MMDL from approved Medicaid MAGI and eligibility SPAs will be copied into MACPro for you to use as the basis for future amendments and to be used as reference material. You will find the MACPro screens pre-populated with the currently approved information, except where the MMDL and MACPro templates differ. Finally, in time, the official and complete PDF copies of all eligibility and administration SPAs approved in MMDL may be viewed in MACPro. So in order to prepare for onboarding, there will be a series of trainings. Today's training covers how to obtain access to MACPro and will introduce you to MACPro user roles, as well as provide an overview of the state submission process. We will be repeating this training for anyone who wasn't able to join today on Thursday, July 27th, as well as next week, August 1st. Future trainings for the states will include an administrative role responsibilities in MACPro. Please note it is essential that all users who will hold an administrative role, such as approval authority for other users, attend this training. As we review the MACPro roles, I'm going to identify which MACPro roles have administrative responsibilities and will require attendance at an upcoming training session. And we will go over when that will be occurring and what to do if you're going to be in that situation as next steps at the end of this training. There will also be in-system demonstrations that will show you how to create and submit state plan amendments in MACPro. So now we will talk about how to obtain access to MACPro. But first, let's take a moment to discuss what you will learn in this section. We are going to review the general process required for gaining access to MACPro and when each step of the process should be completed. This process flow provides an overview of the steps required to obtain MACPro access. And during this training, we will go into more detail on each of these steps, so do not worry. At a high level, the actions required to gain access to MACPro are as follows. Register for an EIDM ID, then log back into the Enterprise portal to request and receive approval for an EIDM role for MACPro, and finally log into MACPro to request and receive approval for your MACPro user role. So in the next couple of slides, we're going to go into more detail around what exactly all of this is and what you need to do. So MACPro Access is managed by the Enterprise Identity Management, or EIDM portal, which is an identity management and services system that provides users with access to CMS applications. Please note that EIDM is accessed via the CMS Enterprise Portal address, which is https://portal.cms.gov. And this is different from the MACPro link, which we're going to review in great detail, but just so you know, the link to MACPro is https://macpro.cms.gov. Now, once you register for an EIDM ID, you should request an EIDM role for MACPro. And please note your EIDM role for MACPro is different than your MACPro role. Your EIDM role for MACPro only provides access to MACPro. Your MACPro role will provide specific action permissions within MACPro itself. All state users should request a state user EIDM role, and detailed instructions on how to do this are included towards the end of today's slide deck and will be emailed to you following this session. We ask that all new users begin the process of registering an EIDM ID and requesting their EIDM role for MACPro now. All MACPro users must have an EIDM ID and approved EIDM role for MACPro to access MACPro. Additionally, some users may already have a role for Health Home Spa or quality measure reporting. So please note that users should only hold one EIDM ID, even if accessing multiple CMS applications through the EIDM portal. So once your EIDM role for MACPro is approved, the next step is to request your user role within MACPro. MACPro user roles determine your capabilities within the application. And as I mentioned, please hold off on requesting your MACPro roles until you receive a notification from the email address macpro@cms.hhs.gov, instructing you to request your roles. The email communication expected in August will include detailed instructions. Please note you cannot access MACPro to request your MACPro roles until your EIDM role for MACPro Access is approved, which we just reviewed on the previous slide. So I know we just went through a lot, so as a refresher, EIDM is an identity management and services portal that provides users with access to CMS applications. The image on this screen provides a visual of the process flow, and we're going to walk through it step by step in the next slides. Please note that steps 1 through 3 on this graphic are orange to indicate that these steps should be completed within the Enterprise portal using the address https://portal.cms.gov. I encourage you to register for an EIDM ID and request your EIDM role for MACPro as soon as possible, as your role request is routed to approvers for review. When you request your EIDM role for MACPro, you will be prompted to go through an identity verification process. More detailed instructions on how to obtain access to MACPro will be sent along with today's slides, and additionally, support materials are listed towards the end of today's slide deck. Also, please note that steps 4 through 6 on this graphic are blue to indicate that these steps should be completed within MACPro using the MACPro link, which is https://macpro.cms.gov. As I mentioned previously, please hold off on requesting your MACPro roles until you receive a notification from the email address macpro@cms.hhs.gov instructing you to request your roles. Written guidance will be included to walk you through the simple steps required to request your MACPro role or roles. Okay, So taking even a closer look, to obtain access to MACPro, new users will first need to register for an EIDM ID via the Enterprise Portal address, which I'm sorry if you're sick of me saying this, but I'm just going to keep saying it so we really remember. It's https://portal.cms.gov. Then, users will need to log back into the portal and request access to MACPro by requesting an EIDM role for MACPro. Please note your request is routed to approvers for review. For these two steps, you will be prompted to enter information about yourself. Once you receive approval for your EIDM role, you'll be able to access MACPro to request your MACPro user role or roles. So the next step, number 4, for those of you following along on the graphic, is to log into MACPro using your EIDM credentials at the MACPro address, https://macpro.cms.gov. You will then request your appropriate MACPro role or roles, and we will review the functions associated with each of these roles in the coming slides. The final step is to receive approval for your MACPro user role, and that will come from your appropriate administrator. Again, please note that it may take a few days for access requests to be approved. And again, hold off on requesting MACPro role requests at this point. We will notify you in the future with instructions to obtain your MACPro user roles, and those instructions will be included in an email sent to you from macpro@cms.hhs.gov. So the process we just went over is an overview of the steps a new user would need to take to access MACPro. I understand that you all may be starting at different stages, so we have a few scenarios that may apply to you that correspond with the How to Obtain MACPro Access process, which is the colorful graphic we've been looking at in the last few slides. If you are a new user without an EIDM ID or MACPro Access within EIDM, you should begin with step 1 to register an EIDM ID and then continue through to step 6, which is receiving approval for role requests in MACPro. And if you are a new user with an existing EIDM ID but do not have MACPro Access in EIDM, you should start with step 2, requesting your access to MACPro through EIDM, and then continue through to step 6. Some of you may already be existing MACPro users for Health Home Spa or Quality Measures reporting. If that is the case, you have an EIDM ID and approved MACPro Access, and you should begin at step 5, which may be, in your case, requesting additional MACPro user roles.